Hi, I'm Adrian Abrams. I'm the Chief Product Owner for the Quality Payment Program at CMS. In this video, we'll demonstrate how our new website, qpp.cms.gov, allows users who represent groups and/or individual clinicians to submit to the Merit-Based Incentive Program. If you're watching this video on YouTube, you can look in the description section of the video for a list of the topics covered and the minutes in this video in which we cover them, so that you can fast forward to the section that discusses topics that are most interesting to you. Before we get into the demo, let's cover a little background. The Merit-Based Incentive Program data submission is comprised of three components: the quality component, the advancing care information component, and the improvement activities component. In this demo, we're going to show how data can be submitted in those three categories in a few specific ways. For the quality component, we'll show how a file, specifically a QRDA3 file, can be uploaded to complete this category. Additionally, we'll show what it looks like to a user representing a group or an individual clinician when they log in and a registry has been hired to submit data on their behalf. We'll show how advancing care information can be completed via file upload. We'll also show the user interface that allows a user to attest to the information on the website itself. And for improvement activities, we'll show how it can be completed via file upload, as well as the attestation user interface that we've built to facilitate the task. A complete merit-based incentive program submission can be completed in one visit to our website and/or using one file or one file format. In designing this product, we focus on providing users clear guidance on how to complete a submission in the simplest way possible. We've created ways for users to track their progress through the submission of improvement activities and through the measures of the advancing care information section. We've also invested in the ability to score quality measures using current benchmarks in real time, so that when a user completes a submission, they get feedback on the score and potential bonuses of those measures. A few things this demo won't cover: the web interface submission process or the submissions API that we've created in our piloting with registries and QCDRs in the first year of this program. You can visit our website, qpp.cms.gov, for more information on those submission mechanisms. Additionally, we've created another series of YouTube videos which specifically cover the web interface submission functionality available on qpp.cms.gov. Let's get into the demo. The submissions process starts with visiting qpp.cms.gov. On January 2nd, you'll see a sign-in option in the upper right-hand side of the website. When you click on that, you'll be prompted to enter your EIDM user ID and password. If you've previously set up an EIDM user account in support of previous CMS programs, including the Physician Value Modifier, the Quality Resource and Usage Reports, the Physician Quality Reporting System, PQRS, and/or the web interface used to submit quality data, and you have a valid user role, we will have imported your user so that you'll be able to start submitting on January 2nd if your password hasn't expired. If you haven't created an EIDM account previously, please visit the CMS Enterprise portal to create an EIDM user account and request roles to represent your organization. Your user will immediately be able to access this website after you have the correct roles approved. You can review the QPP EIDM user guide that's available by visiting qpp.cms.gov in our resource library. For this demo, we've created a fake account. I will be a security official, so I'll have the role in EIDM of security official with a group practice. Review the statement of truth You must affirm that you're certifying that you're submitting data that is true, accurate, and complete to the best of your knowledge. We'll ask you to review this. Again, I'm doing this in a demo environment. For the purpose of the demo, I'll attest yes. Signing in, you'll hear a phone call. I've set up multi-factor authentication for this account using my phone.
Hello. Thank you for using our phone verification system. Your code is 373662. Once again, your code is 373662. Goodbye.
Now I've landed on the account dashboard. The account dashboard is constructed using a user's approved EIDM roles. So in this case, the security official that I am currently has roles with 3 separate practices. Notice that this enables me to start a submission as a group or an individual for this specific TIN. I could also start a submission for the next TIN and start to report as a group or for an individual within that group here. I'll choose to report as a group. And now this menu appears. It provides me access to the 3 components of the MIPS submission: the quality measures, the advancing care information, and the improvement activities. You'll also notice the left navigation. It's providing me information on the TIN for which I am starting a submission, as well as another way to navigate to the 3 components of the MIPS submission. Let's start with quality measures. If no quality measures have been submitted for a group or individual, you'll see this menu appear. In this case, there are 2 options here for this user. For this group, they can begin to start submitting quality measures via a file upload, or if this group has hired a registry or QCDR, EHR, or other third-party vendor to compile, aggregate, and submit their quality measures, this is the point in the process where that agency would take over for them. If the group had registered to use web interface to report quality, there'd be a 3rd option available for that group on this screen here. That's not the case. We are going to, in this demo, submit quality data via file upload ourselves. This file upload modal appears. It provides guidance that files can be uploaded in QPP or QRDA3 formats. We're going to upload in QRDA3 format because it's the format produced by EHRs. We can drag and drop a file from our local machine here, or we can browse our directory. I've saved my QRDA3 XML file on my local desktop. I'm going to open. You'll see that QRDA3 XML file. It's in a pending upload status. I'm going to upload it. When I click upload, the format of the file as well as the construction of the measures within the file is validated. If it's valid, we'll create a submission for this TIN on qpp.cms.gov using the data in this QRDA3 file. Just a note here, this file actually has quality data, improvement activity data, and advancing care information data. So you'll see the results of this file upload throughout the demo. So now we have successfully completed the upload. We've created the submission. Let's go review it by closing the modal. Our previous menu is converted into a quality submission summary screen. This will be a repeated design, so I'll go over a few of the design elements here. First, you'll see a link here for full instructions on how to use this page. You'll notice that the file upload is now turned into a button on the right-hand side. This calls the same modal we just used. And right below that is a delete category button, which would allow us to delete the results of the upload we just performed. The submission screen starts by defining which submission methods have been used to transmit quality data to qpp.cms.gov. A QRDA3 file uses the EHR submission method. You'll see EHR here. And we've scored the measures we've received against the benchmarks we currently have in real time and have determined that the submission would score 60 out of the 60 possible points for the quality category in the submission. Let's review how that's determined. You have the ability to submit more than the 6 measures that will be used to create a quality category score. We will evaluate the performance rate for each measure you submit, we'll compare them against the benchmarks, and as well as add in the bonus points and determine which of the measures you've submitted comprise the top 6 measures that would give you the greatest score. Additionally, we've designed this product to score all of the measures you submit so that we provide meaningful feedback for every measure that you've invested in aggregating, compiling, and submitting to qpp.cms.gov. Let's review how we score these measures. So the first category will highlight the 6 measures that comprise the performance score. Each measure submitted will create one of these horizontal bars. In this case, you'll see the measure name, the measure ID, the performance rate we received in the file, and then the comparison of the performance rate against the benchmark, as well as the addition of bonus points, if any are pertinent to this measure, combined into a measure score. To the right of the measure name, there's a drop-down arrow. When you click that, you'll see the details broken out on how the measure score was determined. On the left-hand side, you'll notice the measure submitted represented as the white circle, the national benchmark represented as the blue horizontal line, with the deciles demonstrated. In this case, this measure scored over 93%, which was in the top decile. On the right-hand side of the drop-down, we'll convert that into points. First, the points from the benchmark decile. So this measure received the full 10 out of 10 points. There were no partial points. Now we'll add the bonus points. There were no high priority outcome or patient experience bonus points associated with this measure, no other high priority bonus points, and this measure was eligible for an end-to-end reporting bonus. That means the total score for this measure was the 10 for the performance points plus the 1 bonus point equaling 11 measure points. This level of detail is available for all of the measures here. And you'll notice that the top 6 measures scored a 62.9 total points, which is greater than the total 60 potential points. So the max 60 points would be earned for this quality category. The next section will break out all measures submitted that included bonus points. Again, the same breakouts are available within these measures. And the last category demonstrates all of the measures that were outside of the top 6 or exceeded the maximum bonus points and so didn't contribute to the score. You'll notice, however, that we do have the performance rates. There is no measure score because this measure did not get attributed to the quality category score. However, if you hit the drop down, you'll see the comparison to the benchmark again, and the points that would have been realized if this measure was counted. So in this case, you see that there are 9 points from the benchmark decile and 9 partial points, no bonus points. This measure would have earned 9.9 if it was considered to be one of the top 6. One other feature I'd like to show you. Let me collapse the left-hand side here, a little more room to work. You can do that by, there's a collapse button on the bottom of the left navigation menu. Just gives you a little more screen room to work with. I'm going to navigate back up to the top here. I have an additional file. So in this scenario, this group has hired a QCDR to compile a series of quality measures for them. I have this file from the QCDR. For the purposes of this demo, I want to demonstrate what that would look like. That is a QCDR file in JSON format. I'm uploading it. It's being validated. It's confirmed to be valid. A submission has been created. And you'll now see a new submission method added to the top here. So previously we had EHR with a score 60 out of 60, and we've just had created a registry dial with a score of 52.3 out of 60. If I click on this, it is now turned into a button. You'll see there below the contents are changing. And you can review the results submitted. And you can see here my top 6 measures scored worse than those measures that we previously reviewed via the EHR submission mechanism. The same breakdown is available measure by measure. The drop-down available to see performance, how that translates into points. And we make available by category, so for quality, advancing care, information, and improvement activities, the most recent submission by each pertinent submission method. So you'll see here EHRs and registry, and when the submission window closes, this group would be credited with the highest score of any submission method within a category. So in this case, they'd be credited with the 60 out of 60 because it is the best quality score that we have received. Let's move on now to the advancing care information section. We can expand back out our left navigation menu. Go up to Advancing Care Information label. The features on the Advancing Care Information page are similar to those on the Quality page. You can read full instructions here for how to use this page. The File Upload button is available again on the right. It pops up the same modal. And the submission methods are here again at the top of the screen. They're not represented by dials on this. They're laid out a little differently, but you'll see the attestation button representing the submission method of completing the submission here on the site, or the EHR submission method. And this tab was created when we uploaded advancing care information in our QRDA3 file earlier. So let's complete an attestation for advancing care information. The page is currently locked down. It's because we've designed this page to guide a user through the process of submitting advancing care information, and that has to start with selecting a proper performance period. If a user inputs an improperly constructed performance period, we'll prompt them that for example, the end date here is greater than the start date, that this won't allow us to proceed down the process of completing advancing care information. Also, if a user inputs a submission period shorter than 90 days, we'll let them know that that means that they're capping their total possible points for this category at 50. For this demo, let's select a performance period greater than 90 days. The next section will allow us to select the advancing care information measure set that we are going to report. There are 2 that pertain: the 2017 Advancing Care Information Transition Measures and the confusingly named Advancing Care Information Measures. This just highlights how you determine which type of measure your EHR can submit. It really depends the year of the certification edition that your technology received. So in this first section, if you've received the 2015 or the 14 or a combination of the 14 and 15, you're able to report the 2017 Advancing Care Information Transition Measures. And then here's the information for the years of the additions that can report the advancing care information measures. This can still be challenging to understand, although we've tried to word it as simply as possible. So we've created a feature to allow you to look up your EHR. It has autocomplete, so I'll just type in EHR, and the first that pops up is Charm EHR. So for this demo, let's assume that the group that I am in has Charm EHR. When I type that in and select it, it'll show me the additions of Charm EHR that have been certified. I'll choose the most recent, 2014, as mine. And so now I can see that the Charm EHR 2014 edition is capable of reporting the 2017 Advancing Care Information Transitions Measure Set. If we scroll to the bottom here, we'll notice that of the three buttons, the 2017 Advancing Care Information Transition Measures, the Advancing Care Information Measures, and then the button that allows me to report a combination of both measure sets, only the first, the 2017 Advancing Care Information Transition Measures, is selectable. That's because of the information that we received about our EHR certification above. If we click on this button, the rest of the form will become available to start completing. If we don't want this guidance and we want to be able to select between the three measure sets ourselves, we can uncheck the selection for EHR in that search box, and now all three buttons are selectable. For this demo, let's go through the 2017 Advancing Care Information Transition Measures. I'll collapse my left panel again. The first section are the required attestation statements. The first two are mandatory, and the third is actually optional. So you'll see right now, I can't fill out information lower down on specific measures. I must first complete these attestation statements. I'm going to review the prevention of information blocking attestation. If I concur, I'm going to click yes. When I do so, it'll turn into a green checkbox. I'm going to review the second attestation, ONC Direct Review Attestation. Review the content and click yes. This now has unlocked the next section of my form. Before we advance, let me just review the ONC ACB Surveillance Attestation, which is optional. I concur and I'm clicking yes. And now we can continue into the measures required for a base score. And you'll see a ribbon now becomes locked at the top of my frame here, which provides my overall Advancing Care Information Category score, currently set at 0 over 100 points. It will start being completed in real time once I have completed the measures required for base scoring section. I can click on any of these question mark icons to get more information about how to complete a section. So first up is the e-prescribing measure. It's the first of the measures required for a base score. I can download the measure specifications if this high-level summary is not adequate. Measure specifications are available via clicking on the blue downward arrow icon to the right of the e-prescribing measure name. When I do that, a PDF will be downloaded to my local browser. I click that and open. You'll see here a 5-page PDF on the details around the e-prescribing transition measure. On the right are the numerator and denominator for this measure. And then here on the bottom is the e-prescribing exclusion. And if I click on the icon, I can see the definition for that. If this exclusion pertains to me, I can avail myself of it by clicking on the checkbox. And you'll notice the entire measure is grayed out, which means I can move on to the next measure without completing this one. In this case, I'm going to uncheck it and complete the numerator and denominator. I'll get a thumbs up which is indicating I can move on to the next section. The security risk analysis measure, the detailed specification icon is available there again. Review the content. In this case, I'm going to test yes. I get a thumbs up again. I can move on to the next measure. Provide patient access. This is a numerator-denominator measure. As we type in the number, our site is trying to save the data to ensure that we've captured it. If we were to lose connection, that would enable you to log back in and see it. What you'll notice is that if there's a delay in typing in a numerator and denominator, the system will inform you, for example, that you have a numerator of 100 over a denominator of 0 in this case, which is an invalid proportion for this measure, and so will not be saved. If I update the denominator to a valid value, you'll see that the data has been saved and captured, as well as I've received the thumbs up and can move on to the next measure. The last measure in the required for base score section is the health information exchange. So as I complete this measure, you will notice that the dynamic scoring will take effect. So we receive our thumbs up, and now we both have a performance score for this measure based on the numerator and denominator we reported, as well as this section has been scored, and you'll see my overall advancing care information category score increased to 72 over 100. Oh, just rapidly before we move on, there is also an exclusion for the health information exchange. If I were to zero back out this measure, this exclusion becomes available to me again. So, although I have not scored a perfect score in some of these measures required for a base score, completing the next section, the optional performance measures, as well as the subsequent bonus sections, can allow me to achieve the maximum 100 points in the advancing care information section. The first measure in the optional performance section is the immunization registry reporting. Again, the same icon for downloading measure specs. I'm going to click yes. And now this measure is going to be scored in real time because we've completed the required measures for a base score. Next measure is patient-specific education. And now secure messaging. Now when I complete this measure, I will have achieved a maximum advancing care information score of 100 points. This yields a green max score box down here, a 100 over 100 in my advancing care information category score, and then the category success trophy, which we'll explain in a second. This means that taking any additional action in the advancing care information category will not get me more points towards my MIPS score. However, you're still very capable of reporting all of the other data that I've gathered and encouraged to do so. The next measure is the view, download, and transmit measure. Enter a numerator denominator here. We'll see how we've performed on this measure, even though the overall score has not increased. The last measure in this category is the medication reconciliation, which we will not report on. And this brings us to the additional registry bonus section. There are two measures in this section. Answering yes to each of these measures yields an additional 5% bonus. However, if you answer yes to both questions, you can only receive one 5% bonus. I'll just highlight here, answering yes to the syndromic surveillance reporting and yes to the specialized registry reporting yields 5 bonus points for the first and no additional bonus points for the second, even though I have successfully completed that activity. The last bonus category in advancing care information is the CERT use measure. If I want to receive this bonus, I must do two things. On this page, I must attest yes, and then in the subsequent improvement activities section, I must have completed one improvement activity which is deemed CERT eligible. And I'll show you how you can see that pretty easily when we get to that section of the demo. Going back up here, we'll quickly take a look at the other submission in the Advancing Care Information category via EHR. You'll see it's grayed out because it was uploaded via file. It can only be updated via file. And you'll notice in the submission that the required attestations were not completed. In other words, this submission could not be scored. It received a 0 out of 100 points. However, we still see the category success trophy. And that's because once you receive that in a category, regardless of the submission mechanism, we're just reinforcing to the user that taking an action to change this submission will not change the maximum points that the user is already scheduled to get for this category. Let's continue on to the last component of your submission, the improvement activities. The improvement activities page mimics the advancing care information page we just completed. You'll see full instructions again here, as well as the file upload button, and the same tabs that demonstrate the submission methods by which we have received improvement activities data for this TIN, the attestation that we'll complete here together, and then the data we received via EHR method, which was again that QRDA3 file from earlier. Similar to the previous page, we must complete the performance period before completing any information further down. There's no minimum 90-day reporting period. And once we've selected a valid time period, the rest of the form will be unlocked. Let's collapse this left navigation. There are 92 improvement activities, so that can be a bit cumbersome to sort through. If you know what you're looking for, there is a text search field available here on the right-hand side. As an example, I'm looking for a Medicaid-specific measure. I type in Medicaid in the text field, and I bring up the engagement of new Medicaid patients and follow-up. In the center, we have a series of filters. They reference the defined subcategories for the improvement activities. You'll also see filtering by weight, so the total number of points that any one improvement activity contributes to the overall 40 potential points. And then the CERT eligible measures. And these are those measures that tie to the last bonus that we reviewed on that previous advancing care information submission. So you must select one of these to receive that advancing care information submission. You'll notice that they have an icon here, CERT eligible. And selecting one of these activities also contributes points to your improvement activity score. We'll clear our filter here. So before we start selecting individual improvement activities, there is the patient-centered medical home attestation, which enables a group who is participating as a patient-centered medical home to receive full credit in the improvement activity section. And you'll see as soon as we check that, we get our max score dialog, our 40 out of 40 points, and our category success. When we uncheck those, See the score go back to 0/40. So if we select the first 3 improvement activities, engagement of new Medicaid patients at follow-up, that's a high, giving us 20 points. Leveraging a QCDR for the use of standard questionnaires, which is a medium activity, giving us 10 points. And then leveraging a QCDR to promote the use of patient-reported outcome tools, which is also another medium activity. We have now achieved our total of 40/40 points. The only action you can take on the improvement activities page is to click yes for any of the 92 activities that have been completed. And if you've clicked something improperly, just again select it again and it will uncheck. The same as the other sections, once we have achieved the category success, the best score via submission method for a category, in this case improvement activity, is what will be used in the final submission. So we click on the EHR tab. You'll see that the EHR submitted IA data, improvement activity data, only scored a 30 out of 40 points. However, we still see the category success trophy because, again, the IA data submitted via attestation received the full 40 out of 40 points. So now we've successfully completed all 3 components of a MIPS submission: the quality measures, the advancing care information, and the improvement activities. You'll notice that we've not hit a save or submit button. You're able to log out and log back in, and the state of the data that you've entered, whether you've entered all the data and achieved category success, or whether you've just attested to one measure or completed one activity, will always be saved for you. So the next time you log back in, you'll return to screens that are exactly in the same state as you leave them now. Additionally, there's no submit button because we've designed this product in a way that allows you to visit the site once or as many times as it takes to feel comfortable about your submission. We will take the final state of your data when the submission period closes, and that will form your official submission. You can revise the data as many times as you'd like, or never revise the data from the first time you log in, before the close of the submission window. At the end of my experience, I'm going to log out using the logout feature. It's updating me here that, again, I can come back in and update my submissions to the end of the submission period. We're also providing some information that the scoring that we provide, specifically on measures, is as accurate as the information that we currently have available. There are certain aspects, like benchmarking, where measures that do not currently have benchmarks will have new benchmarks created at the conclusion of the submission period. This information will be detailed in your feedback reports that will come subsequent to the submission period's closure. Thanks very much for your time in reviewing this video. You can find more information about the program as well as other useful tools on qpp.cms.gov.